Welcome back from the break. Now, the Narcotics Control Commission is distraught over the growing abuse of nitrous oxide by the youth in Ghana. Otherwise known as the laughing gas, the chemical compound is legitimately used for medical, commercial, and industrial purposes. But its sweet scent and taste has seen many individuals, especially the youth, relish the happy moment it brings. This afternoon, we will have a conversation on the effect of the abuse of this substance and the solutions to this growing problem. But first, let's take the following report, which chronicles how the youth are using this nitrous oxide in Ghana.
It's a chemical originally intended for good. Nitrous oxide has become the new drug craze. Many use disguised means, including discharging the gas into special balloons before inhaling it. Speaking on Love FM, Ashanti Regional Director of the Narcotics Control Commission, Samuel Yeboah, expressed worry over the ballooning abuse of the chemical compound.
People are making money out of these drugs. Okay, like the balloon we are talking about. People are making money out of it. Okay, now it has become their business, the work they do every day, and so they always have to find a way of getting money from some of these things, and so they also have a way of marketing them.
How come people, ordinary people, can then tell that I can use this chemical to get high?
Yeah, let's also not forget that even the hospitals get these drugs from the open market. Okay. Previously it was the people working in hospitals, it was the medical students or whatever who were coming into contact with some of these drugs. But they also have friends. And let me tell you, some of the students were even abusing these drugs secretly. Some of the medical students were even abused, just like if you go to the hospital, people abuse Pitidin and others. They were also abusing them secretly. Are you get what I'm saying? So it is very possible that these were the same people who introduced their friends who were not, people working at the hospitals into some of these, the use of these drugs.
The chemical works by triggering the human hormone dopamine that thrusts the user into a ballistic mood. However, studies have found the chemical to have harmful effects on the heart and brain upon long exposure.
Talking about the laughing gas, the nitrous oxide, has some negative effects. They give people low blood pressure.
Low blood pressure?
Yes,
wow.
Low blood pressure.
Okay.
They can give you heart attack. Continuous use, you develop anemia. Okay. They also cause nerve damage. And if you inhale it in such a way that you are not able to breathe in oxygen.
Although legal in the country, Mr. Yeboah believes measures should be instituted to contain the abuse of the chemical.
Control of these substances fall under the purview of Food and Drugs Authority. I think that as early as possible they need to come out with some regulation on the use of these substances. Just like Leo was telling us, in the United States, you cannot possess it. Okay, if you give to somebody, you can be arrested. I think we can also go that tangent and then make sure we're able to control some of these substances, because else it will get out of hands, like you're saying. For now, because there is no law, there's no regulation, people are free to do whatever. The only thing you can do is to just talk about it.
For Joy News, my name is Emmanuel Bright Kweku.
So that's our setup for a conversation on this. Joining us via Zoom is the Director, Head of Tobacco and Substance Abuse Directorate at the Food and Drugs Authority, Dr. Olivia Ajekumwa-Boateng. We also have the PRO for the Ghana Psychological Association, and who is also the Acting Director of UPSA Health Directorate, Dr. Isaac Newman Arthur. Grateful to you, ladies and gentlemen, for joining us. Let me start with you, Dr. Olivia. How is the FDA tackling this development?
Good evening, and thank you for having us. Yes, in your intro, you mentioned that it is being noticed that it's being abused by the youth, but it also has illicit users. So we have registered it for the food grade, where it is used as a preservative. Okay. It is used for baking. It is used in the pubs and nightclubs for cocktail drinks. it has local anesthetic and analgesic effects, so it is used in dentistry and also in surgery. And so because of these illicit uses, we actually have some registered. And to stop or curb the abuse, we put in a lot of regulatory interventions and restrictions, some of which include frequently asked questions or FAQs. We quickly and promptly had to come out with these very basic, simple information for the general public to appreciate the harmful effects of nitrous oxide if it is used for recreation or to induce euphoria and not for the intended purposes that I have already mentioned. And this we did nationwide. After we had done a lot of nighttime monitoring to assess the situation and also even find out that it is really an Accra and Ashanti region problem and not basically in all the regions. It's not so widespread. Then we routinely do public education in the schools. And so we have added it to the public educational materials, telling them about the harmful effects and the long-term harmful effects and also short-term harmful effects, which include the gastrointestinal effects of these nausea, vomiting, central nervous system effects of dizziness. It can also cause memory loss. It actually can cause coma, and eventually you could even die depending on the concentrations that you use. We've actually also restricted or reclassified its use. So it is not on the open market, just like the NACOP officer was mentioning. Because of the pending abuse, for those we've registered it for, they are doing utilization returns, or they are reporting on where they are taking it to. We are doing this to ensure that it doesn't find itself in the illicit market where the people who want to abuse it can. So if you say that you registered it to use in the food grade, use the food grade in the food industry, you would give us returns or utilizations for us to come routinely or unannounced to monitor to ensure that it doesn't find itself in the abuse. We actually are also doing a lot of public education on radio.
If you say so, then I ask, where are the people who we've seen, abusing this nitrous oxide, getting their supply from?
Yes, so before we started introducing this, we had to do a lot of monitoring to ensure that this is what was happening. So prior to this, you could get people selling on the open market. But when we started, at least we've been able to restrict its sales for the intended purposes. What we are having on our hands possibly could be due to the fact that other agencies like EPA gives authorization for the industrial uses. Possibly it could also be coming from those angles. So we have actually engaged them so that we could sit down with them to ensure that these classifications and the restrictions we are bringing on board will be holistically done nationwide to every other person who also intends doing trade in nitrous oxide. So to a large extent, we have this under control. We are doing a lot of public education on it. We actually have had professional groups also support this by the Ghana Dental and Medical Association issuing a press release. The Society of Anesthetics also issuing a press release, also to caution even their staff who use it to restrict it to professional use and under strict supervision. All these measures are in place so that we restrict its use for the intended purposes and not the recreational abuse that we have found our youth meddling in.
Okay. Let me bring in Dr. Arthur here. Dr. Arthur, you are a clinical psychologist. Dr. Kumiwa has given us some of the health impact, but what are the long-term health effects of this particular nitrous oxide on the users?
So thank you. Greetings to all your viewers. Well, when it comes to some of those things, like she said, it has its own positive benefits. And regulation around these things become very, very difficult. The same as marijuana and other substances of abuse. So regulation kind of very, very difficult. And anything that creates some level of euphoria and relaxation and stuff, people are likely to abuse it. Either to perform or to feel better or to do better. And sometimes just out of curiosity. And sometimes even the discussion of it, now introduces people to some of these things. Because without these discussions, they will not even know that those things exist. And so sometimes even media reportage is very, very important. Yeah, but what it does is that it actually destroys the nerves. Our ability to communicate with our environment, to think, to reason, to feel, to understand, to remember. The nervous system is responsible for it. And what it does is that it actually destroys the nerves, the cells that, make up the nerves and the brain and the spinal cord, the neurons. That it destroys, there's a sheet around it that vitamin B12 actually helps in terms of, what do you call it, the maintenance of these sheets that wrap around these neurons. And so, when someone uses it for a long time, what it means is that the nerves are not able to function well. So they may have some impaired cognitions, impaired memory, movement may also be affected. They may have risk of depressive symptoms, psychotic symptoms. They may have some auditory hallucinations. They may have, what do you call it? They may even become, delusional. There are all kinds of studies that have been done around these things. So the long-term implications, they are chronic neurological deficits. So it's not a good thing at all. It actually destroys people's nerves and all that. So, yes.
Now, to make you, or to take you in a state of happiness and keep you there, obviously may have some impact of a sort on your mental, or would have some mental effect. Isn't that the case? Since you're a clinical psychologist.
So the short term, so we have short term, euphoria and relaxation. When people use it in lower amounts, they have that. It may totally numb them, and stuff like that. But the chronic use, what it means that, the neurons are going to be destroyed. And that is what you need to be able to, your reflexes, your ability to respond to things, communicate with your environment, to reason, to judge, to remember. That is what the nervous system is for. And all these activities are going to be affected, including your movement. So you may have weak muscles and bone and stuff like that, just because the nerves that are involved in this, they are not functioning well. So that is a layman kind of explanation to these things.
Okay. I mean, just this weekend, I met a young guy who had taken, I suspect they told me was Tramol. And he just couldn't recognize where he was and what was happening to him, because this guy was sitting straight, but he was sleeping and was making some gestures that he couldn't really explain. Now, when this Tramol came, we spoke against it. We waged a war. It doesn't look like we've won. And this is also coming up. So how do we really deal with some of these abuses so that we don't have our youth, especially, wasting all their life at early stages?
Well, I think one of our biggest problems in the country is regulation. Everything is difficult to regulate in the country. And so pharmacies are not supposed to even sell tramadol. People are not, it's not supposed to be easy to access it. But things happen. When you go to a lot of the pharmacies, you may not even have a pharmacist there. Some of the over-the-counter medications can be sold. But there are a lot of drugs that should be prescription drugs. In anti-malarials and antibiotics and all those things. You should have a doctor's prescription for those things, because those things are not simple drugs. They are major things that people must have prescriptions for. But now you go to pharmacies, and some pharmacies even diagnose diseases. It's not supposed to happen. You go to now, people, when they have symptoms, they go to the pharmacy for diagnosis. You know, and really, people may not be regulated on all these levels. So I think our problem has to regulate people doing what they are supposed to do in the right way.
Okay.
You know, and unfortunately, those things are not happening. Yes.
Okay. All right. I'm grateful to you. But let me bring in, Dr. Olivia Ajekunwa-Boateng. Doc, so, I mean, you say you've contacted the EPA to see what could be done in that area as well. But, I mean, what else do we need to ensure that these abuses end? Because I'm sure since you started engaging the EPA, it's been some time. But these abuses are still happening. What can we do?
Thank you very much. And I think that just before I answer this question, let me quickly comment on what Dr. Newman said, that even though we have issues with regulation to a large extent, we are doing very well because of the processes we have put in place. Okay. And for pharmacies, they could also dispense medicines, treat diseases of common occurrence, simple colds and things. And you would have pharmacies who insist on serving or dispensing medicines with prescriptions. So it is not that we have to throw our hands in the air with despair. Because when you mentioned tramadol abuse, for now, tramadol abuse is to the minimal levels. And what we are envisaging, even with this abuse, is a global trend. You know, I'm not making brief for the youth, but because of the social media, anything happening elsewhere finds itself in our country. You'd realize that other countries have this much of a bigger problem than even Ghana. That notwithstanding, we are doing a lot of things and put in a lot of regulatory interventions. And you should be rest assured that public health and safety is the thing that we try to do. Let me tell you some of the measures that we have put in place, which includes even tramadol abuse. Because these products are illicit, you would have to make sure they are available for medicinal purposes, as well as trying to curb the potential diversion and abuse. And some of what we have done is to try and ensure that you put in authorization or give permits before the products come into the country. I must admit, occasionally you may find some that will come through our porous borders. But there's even stringent border control to take care of all that. So we have, like I mentioned, with other agencies, not just EPA, even mental health. At that meeting, we had them on board and other stakeholders who would also speak to some of these issues. We are actually currently finding out if there are alternatives for the uses of nitrous oxide. If we have something that can replace its use in the food industry, if we find out that in surgery and even dentistry there are alternatives, then we can bring stricter sanctions or even say we are banning it because there'll be alternatives to do that. But you need to do a lot of baseline studies and get board approval. So as we speak, this is of high interest to even our board. Our board has asked that we do what I'm talking about to bring them a report so that they can take a decision. So we are not just sitting down, not doing anything about it. If it means that we should bring in alternatives, there are alternatives to serve the same purpose, to ban it, we do. And then we also are doing stricter monitoring. We even do nighttime monitoring with the help of the police, because these social interventions, you can only find them during the nighttime, pubs and nightclubs where these and other social events where these can be used. It's only at night. So we do nighttime monitoring and we bring the people who are using it other than the intended purposes to book. When you are found doing some of these things, there are sentences and penalties and administrative charges. Sometimes it even involves prosecution. So
how long has this been going on?
We started, it's over a year now. But even in your station, we've been there to talk about this.
I get it, but here we are being told by the Ashanti Regional Boss of the Narcotics Control that the abuse is still going on. So if after a year, the abuse is still happening, are we going to change strategies?
You actually will bring them to minimal levels. Because no matter how much you talk about it, you actually have people who are already addicted to these substances who need psychosocial support, like what the doctor mentioned. These people have to be weaned of it so that they wouldn't go and do it. We have a situation on our hand where our rehab services are woefully inadequate. So once we take one substance off, they go to find another substance. So you and I will come back and talk about another substance recently, because the people who are really addicted to these substances are not getting help. We actually are having multi-substance use disorders on our hands because it is not just nitrous oxide. Okay. They would add to alcohol, they will add it to other substances, and the fear is the potential of expatiated or potentiated effects when they even have this multi-substance use. So the conversation is still ongoing, and we are doing a lot on our hands to ensure that, if not eradicated at all, we bring it to minimal levels.
Okay. You mentioned expatiated effect. What is that?
What I'm saying is, when you go out, those who want to have the euphoria and have a high and party, it is not just nitrous oxide they use. They would actually buy alcohol. They would actually have a concoction that they may lace with other substances. So what you have on your hands be a synergistic effect of what the doctor mentioned, that is having the person taking the nitrous oxide. If it's going to be respiratory depression, you are going to get it more because alcohol is also going to induce respiratory depression. You may just be there partying, and before we realize you are even in a coma. So what we have on our hands is bigger than just regulation, and we just think it's a multi-stakeholder approach, and everybody has to come on board.
Okay, all right. So I guess you mentioned everybody has to come on board. You have the EPA. Who and who are you engaging to ensure that all of us are
we
together?
We have the professional groups, the practice, those in the service delivery, Ghana Health Service. By that I mean the doctors, pharmacists, the anesthetists who use these products, the mental health authority, because at the end of the day, when people call to us for where they should get addictive or cessation services, we refer them to these services. The Narcotics Control Commission, because aside the illicit products that they handle, these ones, they have oversight responsibilities too. So we work with, and then Ghana Education Service. We actually work with the SHEP division because we are making input into their curriculum. We go to do public education in the school, so you have to give them something to even be talking about. The religious bodies are on board. Our traditional rulers are on board. When we go to some of the regions, they actually have local solutions. A chief can say that, I'm even issuing a curfew at my locality, because after 8, that's when the youth would go to certain areas and patronize. Because we have gotten all of them on board, because elsewhere in some of the regions, it is a local solution we need. We went to the northern region where a chief has decided that tobacco is a staple, but they are trying to find other means or other forms of incentives to replace the staple because of the side effects. So it's a whole continuum of interventions that we have.
Okay, all right, Doc, I'm grateful to you. Dr. Olivia Ajekumwa-Boateng is the head of Tobacco and Substance Abuse Directorate at the Food and Drugs Authority. Also, I had with me on this conversation the acting director of UPSA Health, Director Dr. Isaac Newman Arthur, who is a clinical psychologist himself. I'm grateful to you for joining us. Now, away from that.